And you heard it right. So today, October 28th on a Monday, as earlier announced in the ad, Meta Zambia is here on Sun 88.5, broadcasting from the heart of Ndola city to the entire Copperbelt and everywhere that you can get us via the internet.
Meta Zambia is a multi-stakeholder initiative involving government, private sector, civil society, organizations, cooperating partners, whose ultimate goal is to improve health outcomes for low income and disadvantaged people in Zambia. Meta Zambia was launched on 31st March 2009 after certain agreements were agreed upon with Meta International. The first survey that was done was called the Disclosure Survey in the Zambian pharmaceutical sector. It was done in April 2010, and it has highlighted a number of transparency and disclosure issues, such as lack of transparency in the public procurement, high medicine prices, high markups, and we were also able to find out that the regular medicines are regulated. They are supposed to be registered and so forth. But for the herbal medicines, they are not regulated. So a lot of people are consuming herbal medicines, but we don't know their efficacy. They are not regulated and so forth.
And now look at how many people are accessing Sondash formula secretly, privately, without the government knowing. And people, some people are bringing out positive results towards it. But is it genuinely positive or genuinely negative? So it is up to the government to actually ensure that that medicine is being put on the table. Let it be de-exed. Let them take a post-mortem again. Let them see, could it do the right thing to the right person who is actually complaining of one or two types of actually illnesses.
My concern has been, though we have not touched that area yet, on the shortage of medicines, the essential medicines as they are called. Talk of ARVs. We are having a very strenuous situation where we're coming from in our community. I'm coming from Mufolira district, and we only have 2 hospitals as the general hospitals. And the area where I go to get my medicines, of course it's a walking distance. I can get there. But the issue of going every week or every month, that is just 4 weeks to go and get my medicines, that is tiresome. So I can see that the government, or is it the Ministry of Health, they have really let us down. I've been on treatment for the past 8 years, and I've never defaulted. I've been an example where I'm coming from, and it was so sad to hear that the medicines were on the shortage. I could not believe it because I was getting my drugs for 6 months. I could only see my doctor or my healthcare provider for 6 months. I can go and check my CD4, then I can go do other things. But my brother, as I'm talking to you right now, yesterday, Friday, what is today? Today's Monday. Last week, Friday, I went to collect my medications. And to my surprise, again, they gave me for 1 month. I'm a busy person, and right now, being involved in Meta, there's a lot of things that we're supposed to be doing as Meta. But should I be going every month to my hospital to go and collect the drugs? And some people, this is why you can see that some people will start defaulting. Many people will start taking drugs because others cannot even afford to go to the hospital to get the drugs.
You even find that a lot of people would prefer going to the herbalist than getting to the hospital. Then after staying there for quite a long time, you find that person is given medication for how many? For 1 week. Are you telling me they would stand that pressure for the rest of the 4 weeks in 1 month?
Like in Zambia, we know very much that most of the drugstores where we buy our medicines are illegal, in that they are either not registered or they are being run by individuals that don't even have, they are not even pharmacists. To an extent whereby they don't even ask for a prescription, The only thing that they'll ask you is, what medicines do you want? If it's antibiotic, they'll give you. Whatever medicine that you want, they're going to give you.
And you wonder, when you go to the clinic or health institution, government health institution, and then you are told that we don't have this medicine, and they give you a prescription, and the doctor himself tells you where to go and buy that medicine. What does it tell? It means that he's got a connection with that drugstore. So I think it is because of that. We need to see that doctors cannot have formal employment again and have another drugstore. You know, it is contradicting.
You see that the coming of Meta on the board has brought out a lot of issues in the community that needs to be addressed. We have seen that people can have their drugstores, as you have put it. People will not mind to take the drugs that are in the drugstores. But sad to say that when you go to the hospital, you will find that the doctor will tell you that you're not supposed to take certain drugs. Like in my case, when I was getting sick, I used to go to the pharmacy and buy Fancida, as we know it. Later on, only to discover that I was not supposed to be taking Fancida. So it is very good that we go to the hospital, let the doctors treat us there. If you go to the herbalist, it's your choice. In my case, I've never been to a herbalist. And I'm one person who is scared to take those drugs because they are not, they don't have a dosage.
I think we should strengthen the capacity for PRA or ZAMRA to monitor these medicines in the drugstores, be it in towns or our compounds. And besides, most of our people live in compound. They live in compound. That's where they stand. That's where they buy their drug. So we should concentrate our energies there.